Have you ever heard a story about one of those like health scares, where something seemingly quite ordinary actually turned out to be like a really fortunate early detection?
Mm-hmm.
Well, it happened to a gentleman named Mr. Ang Chin Chay.
Huh.
A simple post-vacation fever
Ooh.
led to some tests, and what do you know? They uncovered early-stage liver cancer,
Wow.
something that could have easily been missed, without that kind of prompt investigation.
Yeah.
It's not just a medical anomaly, though, right? This kind of story. It highlights this really powerful insight,
Mm-hmm.
being proactive about our health. And
Mm-hmm.
embracing those, medical advancements can lead to these crucial early discoveries that we might otherwise miss.
Yeah. And, Mr. Ang's experience is really the perfect segue into what we're delving into today. We've really immersed ourselves
Yes.
in this incredible wealth of information from the recent NUHS Scientific and Innovation Summit, all centered around this really compelling vision for healthcare. Tomorrow's health today, predictive, precise, and personalized.
Exactly. And for you, dear listener,
Yes.
this isn't just like a behind-the-scenes peek at the world of science.
Right.
We're going to unpack the most exciting presentations from this summit,
Yeah.
and really break down
Yes.
how this cutting-edge technology and research are fundamentally
Yeah.
changing healthcare.
Yeah.
It's a shift towards medicine that's designed specifically for you,
Mm-hmm.
and that focuses on preventing illness
Right.
before it even takes hold.
Absolutely.
Okay, so let's jump right in.
Yeah, let's do it.
Starting with how we're actually getting better
Mm.
at seeing risks coming way before they become serious threats.
Yeah, it's incredible.
What's really groundbreaking is this increasing ability
Mm-hmm.
to identify potential health issues in individuals who might not
Yeah.
traditionally be flagged as high risk,
Right. Mm-hmm.
And Dr. Huang's work on liver cancer screening is like a fantastic illustration of this.
Absolutely.
He's focusing on patients with fatty liver who don't yet have cirrhosis.
Yeah, that's key.
Fatty liver is pretty common, right? It's just a buildup of fat in the liver.
Right.
And cirrhosis is like a more advanced stage where the liver becomes scarred.
Mm-hmm.
But here's like a really key insight.
Right.
Dr. Huang's research found that nearly 40% of liver cancer cases linked to fatty liver actually occur without this advanced scarring.
Yes, without the cirrhosis.
Oh, so that's a real eye-opener, right?
Yeah, it is.
So if you have fatty liver but not cirrhosis, you might not even be considered
Right.
for regular liver cancer checks.
Precisely.
And that's really at the heart of Dr. Huang's work.
Mm-hmm.
It's how do we risk stratify people with fatty liver,
Yeah. Mm-hmm.
Imagine trying to sort through this
Yeah.
large group of people to find the few
Mm-hmm.
who are most likely to develop liver cancer.
Yep.
Early detection
Mm-hmm.
of hepatocellular carcinoma, or HCC, is absolutely critical.
Yes.
Why? Because in its early stages,
Right.
it often shows no symptoms.
Mm-hmm.
Just like in Mr. Ang's case, if it's discovered late,
Yes.
the odds are,
Yeah.
unfortunately, much tougher,
Right.
with a 5-year survival rate
Mm-hmm.
under 20%.
That's right.
So what new approaches is Dr. Huang investigating to make this early detection more effective?
Well, his presentation really highlighted the potential of non-invasive tests and, more sophisticated imaging techniques.
Mm-hmm.
The aim is to find easier and more accurate ways
Yeah,
to screen this particular group,
right.
allowing doctors to intervene much earlier
Yeah,
and potentially save lives.
that makes perfect sense.
Yeah.
Catching things early
Mhm.
with less invasive methods.
Yeah, absolutely.
Now, shifting gears a bit
Much
towards
of you.
delivering care that's incredibly tailored.
Mm-hmm.
Let's explore this digital twin concept.
Yeah.
It sounds like something right out of the future, right?
It does. It does.
But it's a very real innovation being pioneered by Dr. Gao Yujia.
Yeah.
Picture this. Having like a virtual 3-dimensional replica
Mm.
of one of your organs.
Right.
Let's say your liver, for example,
Uh-huh.
created from your own medical scans, like MRIs.
Yeah,
That's basically the essence of a digital twin.
exactly.
Okay, so it's more than just like a detailed image on a screen.
Oh, absolutely. Much more.
It actually transforms those like static images into these dynamic models.
Right.
It can recreate the organ's exact shape and even simulate how it behaves structurally.
Yeah.
This offers huge advantages, particularly when you're planning for complex surgeries. Surgeons can use this virtual model to really understand the patient's unique anatomy
Right.
before the first cut is even made. Think of it like a detailed rehearsal before the actual performance.
Yeah, a perfect analogy.
That sounds like it could dramatically enhance the precision of surgery.
It can. And it becomes even more powerful with holomedicine,
Wow.
which is another area that Dr. Gao presented on.
Uh-huh.
This is a mixed reality technology that basically overlays virtual objects onto the real world.
Okay.
So during an operation,
Yeah.
a surgeon wearing a special headset could see a 3D holographic image of the patient's liver based on their digital twin,
Okay.
right, within their operating field.
That's where it gets really fascinating.
Yeah, it is.
So they can essentially see inside the patient in real time without actually needing to make extensive incisions initially.
In a way, yes.
It's incredible.
It is. It provides unprecedented accuracy for planning the surgery and even guiding the surgeon's hand during the procedure.
Yeah.
They could visualize the precise location of, say, critical blood vessels and other structures,
Right.
anticipate how things might shift during the operation,
Okay.
and ultimately minimize the risk of damage to surrounding healthy tissue. This can translate to fewer complications,
Right.
shorter surgery times,
Right.
and a much quicker, smoother recovery for the patient.
Wow.
It's a real paradigm shift in surgical precision.
What a remarkable leap forward.
It is.
From virtual organs to tackling diseases at their most fundamental level.
Yeah.
The case of Mr. Sojanto Nagaria really highlights those diagnostic challenges we can sometimes face.
It does. His situation was particularly complex because he was actually diagnosed with two completely separate and unrelated types of lymphoma.
Okay.
Initially, one was even mistaken for liver cancer.
Wow.
After a surgery overseas.
Hard to imagine.
It is. And, this really underscores this critical point.
Yeah.
Sometimes traditional diagnostic methods can fall short
Right?
in the face of such complexity. And it highlights the urgent need for more precise tools.
Absolutely.
Because knowing whether these two cancers were related
Right.
was absolutely crucial. Different treatment strategies.
Right.
Completely different.
And this is where the NUHS Precision Oncology Program,
Yeah.
IAMAC, played a vital role. Correct.
Exactly.
Yeah.
Through the Integrated Molecular Analysis of Cancer program, Mr. Nagaria underwent molecular profiling,
Okay.
which essentially involves analyzing the genetic makeup of his tumor tissue.
Right.
Think of it like getting a detailed genetic fingerprint of the cancer.
Interesting.
This in-depth analysis revealed a crucial piece of information. The two lymphomas were indeed unrelated.
Okay.
So this precise finding was essential in determining the correct and ultimately life-saving treatment plans. He underwent several rounds of chemotherapy
Okay.
and is now thankfully in remission.
Wow, a truly incredible outcome.
It is.
Made possible by that deep molecular understanding.
Absolutely.
And building on this idea of molecular precision. Dr. Deosekaran's work on spatial phenotyping
Yes.
sounds like the next frontier.
It does.
It's like taking that molecular information and mapping it out visually.
That's a great analogy.
Like a visual representation. Dr. Deosekaran describes it as creating highly detailed battle maps of tumors, but at this microscopic level, revealing the precise location and interactions of different molecules.
Exactly.
This advanced imaging allows researchers and clinicians to analyze cancer in a much more sophisticated way, understanding not just what molecules are present, but where they are within the tumor and how they interact with their surrounding environment.
Yeah.
So it's not just about identifying the enemy.
Right.
It's also about understanding their specific tactics and the terrain they're operating in.
Precisely.
And the potential applications are vast, particularly for solid tumors.
Absolutely.
It can lead to more accurate diagnoses, help predict how a tumor might respond to different therapies, and ultimately guide more personalized treatment approaches.
Exactly.
As Dr. Jayasekaran himself emphasized.
Yeah.
The goal is to move beyond those standard treatments and truly understand how to improve the chances of a cure for more patients.
That's the goal.
That commitment to pushing beyond the standard is so vital, and it extends to conditions once considered untreatable, such as many blinding retinal diseases.
Yeah.
A. Prof. Sushini's work in ophthalmology beautifully illustrates this personalized approach.
Absolutely. In many inherited retinal diseases that can lead to blindness, each patient often carries this unique underlying genetic mutation.
Okay.
So this key insight means that a one-size-fits-all treatment strategy simply won't work.
Right.
Prof. Su's research is centered on developing therapies that are specifically targeted to these individual genetic defects.
And gene therapy is one avenue she's actively pursuing.
It is. That's a very promising approach for certain conditions.
Okay.
But she's also pioneering the use of cell therapy, particularly as a last resort.
Right.
For advanced age-related macular degeneration, or AMD.
Right.
In AMD, the retinal pigment epithelium, or RPE cells, which are essential for healthy vision, deteriorate over time.
Okay.
The core idea of cell therapy here is to replace these damaged cells with healthy new ones.
And the really innovative aspect of her work lies in the source of these replacement cells, right?
Exactly. Instead of relying on cells from the patient themselves or other sources that could trigger an immune response, Prof. Su is exploring the use of cells derived from the umbilical cord.
Interesting.
Which is a significant advantage because these cells are less likely to be rejected by the patient's body.
Okay.
Potentially reducing or even eliminating the need for immunosuppressant drugs, which can have significant side effects.
Absolutely.
This is a crucial step in making cell therapy a more viable option for these challenging conditions.
That's an incredibly ingenious way to overcome a major obstacle in cell therapy.
Absolutely.
It's truly inspiring to see this level of personalization being applied, even to conditions that were previously considered beyond our ability to treat effectively.
Yeah.
Now let's maybe shift focus slightly, but stay within the realm of tomorrow's health today by looking at how we can actually predict and prevent lifestyle-related diseases like obesity.
Yeah.
Dr. Jocelyn Chu's work sounds like a really proactive strategy.
It is. Dr. Chu is focusing on what's called predictive care for obesity.
Okay.
Aiming to intervene early before it leads to more serious health complications.
And her work involves two key innovative tools. The first is a mobile application called ETRP, which stands for Eating Trigger Response Inhibition Program.
Okay.
This app is designed to help individuals gain like a deeper understanding of the specific situations or triggers that lead them to overeat. These could be emotional states, ingrained habits, or even just social settings, you know? It's about understanding the why behind those eating behaviors.
Exactly.
So it's about identifying those personal vulnerabilities that can lead to overeating.
Precisely.
And the second tool is a DiboView, which is an AI-powered dashboard. This system integrates patient data from across the entire NUHS healthcare network to identify patterns and predict which individuals might be at higher risk of developing obesity or who could benefit from additional support in managing their weight. The real strength of a DiboView is its proactive nature.
Exactly.
It allows healthcare providers to reach out to patients who might need intervention before their condition becomes more severe. It's about getting ahead of the curve.
Absolutely.
It sounds like a really comprehensive and forward-thinking approach to tackling a very widespread health issue. It's truly impressive to see all this cutting-edge innovation happening within a single institution. The sheer scale of the NUHS Scientific and Innovation Summit really underscores that, doesn't it?
It absolutely does. With over 60 leading clinician scientists presenting their groundbreaking work and attracting over 500 attendees, it really does highlight this dynamic and thriving research and innovation environment within NUHS.
And the fact that they've secured over $1 billion in competitive research grants over the past decade clearly demonstrates that significant commitment and investment in advancing this vision of predictive, precise, and personalized healthcare.
Absolutely. Ultimately, the aim is to translate all this incredible research into tangible improvements in the health and well-being of patients.
Right.
Both now and for generations to come.
So to bring it all together for you, our listener, today's deep dive has explored some really significant shifts happening in healthcare.
Yeah.
We're moving towards a future where we can predict diseases earlier and more accurately, even in seemingly low-risk individuals.
Absolutely.
We're seeing treatments become incredibly precise and tailored to your unique biological makeup, right down to the molecular level, and even visualized in 3 dimensions before surgery.
It's incredible.
And we're also seeing these proactive strategies emerge to help prevent lifestyle-related diseases from taking hold in the first place.
Exactly. The innovations showcased at the NUHS Summit represent this fundamental move away from a more reactive one-size-fits-all model of healthcare.
Right.
Or it's a future that is far more proactive, individualized, and ultimately more effective.
Right.
These advancements hold tremendous potential to positively impact not just healthcare systems, but each and every one of us on a personal level.
It genuinely feels like we're on the verge of a new era in medicine. And on that note, here's a final thought to consider.
Okay.
With all these incredible advancements in early detection, personalized treatment, and preventative strategies we've discussed today, which of these areas resonates most with you when you think about your own health journey? What questions does this raise for you about how technology and research are increasingly becoming intertwined with your personal well-being in the years ahead? It's certainly a powerful and exciting landscape to contemplate.
It is.
We'll see you next time.
Take care.
On The Deep Dive.